Good morning, good afternoon, good evening, everyone, and a warm welcome to our fourth and last peer support session for the WHO Scholar Level 2 certification on Comprehensive Vaccine-Preventable Disease Surveillance. And as always, it's a real pleasure for me to be with you, to support you, to learn with you during these peer support sessions. And if you cannot hear me, please just follow the 2 steps on the screen to turn on your audio. And if you're having issues of bandwidth, you can stop incoming video following the process on the screen. And if you want to speak, please feel free to raise your hand and I'll be delighted to invite you to unmute yourself. So where are we as far as this course is concerned? We are actually in the 4th session, which is the session that is focusing on peer review. You're supposed to submit 3 peer reviews of your peers' vaccine-preventable disease surveillance action plans. And the deadline is today, the 18th of July, 2022, before 11:59 p.m. Geneva time. And let me remind you that this is one of the 5 certification requirements of the course. So you already submitted your action plan last week, and the certification requirement that is indispensable for you to make it through this course is also submitting constructive feedback to the VPD surveillance of surveillance action plan of 3 colleagues. And then afterwards, once you receive feedback from peers, you should be able to revise and improve upon your action plan and submit the improved final version. So we had 88 scholars that submitted the initial version of the action plan. And as at this morning, 63 of you had completed 3 peer reviews on peer grade. So I want to congratulate all 63 of you. The names are on Telegram. I shared the list this morning on Telegram, so you can check over there. But I want to just invite these 21 scholars. If your name is on this list, it means that you have not yet submitted any peer review on peer grade. And so please, if you're having any difficulty and you are in the room right now, I'd like to invite you to raise your hand, share your challenge with us, and we will be here to give you the support that you need. If you're not having any challenge and you just decided to set out time to do so today, I encourage you to do so at the earliest possibility, because the deadline for today for you to complete 3 peer reviews is today. It's in about 12 hours. So you may think that 12 hours is a long time, but if you are a busy professional like most of you are, then if you don't consciously set aside time to do that, you may find out at the end of the day that you were not able to meet up. So I'm encouraging you, please go do well to submit the 3 peer reviews before the deadline, because no extensions are going to be allowed. There will be no extensions because this is a level 2 course. And so you, after that deadline, if you haven't completed 3 peer reviews, you risk missing out on the certification for the course. So we already know why peer review is important, and you know that your peers depend on you, just as you depend on them to complete the course and to improve their VPD surveillance action plan. And as you do so, remember the golden rule is write in a way that you would like to receive feedback yourself. Write in a way that you would like to receive feedback yourself. And there are these key questions you need to ask yourself. I hope that for those who already completed their 3 peer reviews, you ask yourself the following questions. You ask yourself the following questions as you were carrying out peer review. And remember, as always, the guiding document is the rubric. You use the rubric to guide you as you carry out peer review. Okay, so how to submit a peer review in peer grade. I'm glad to see that many of you figured out how to do that, but it's you log on to peer grade, you select the WHO Scholar Level 2 VPD Surveillance Action Plan initial version, and then you click on give feedback, and then you follow the following steps. You will see the first submission that shows up. It's the first work you need to review. You carefully read that work, and you scroll down to choose a rating and explain your rating. And then, you you explain your reading with very constructive comments that will help the peer to improve upon their work. And once you do that, once you have rated all the different sections of the work, you go down and you click on submit feedback. So basically, that is it for the different steps for peer review. Right now, this session is peer support session. You are here to support peers that you need and to receive support as well. And the best way for you to support, for us to support each other, is even through experience sharing of the work that we have done. So I'd like to invite you to raise your hand if you want to share, share what you did as far as peer review is concerned. So even if you're not able to share your screen, I can do the screen sharing for you. So, but just go ahead and raise your hand and show us one and tell us one VPD surveillance action plan that you peer reviewed. You summarize the author's action plan, focusing on the actions that were proposed by the author, and then you explain what comments that you gave to the author and how those comments can help the author improve upon their action plan. And then for the peers that will be listening, you will be able to share how can the presenter improve their peer review. And you can do that by sharing your thoughts, your comments in the chat, or by raising your hand, and I'll be delighted to invite you to unmute yourself. So my eyes are on the participants list. Please go ahead and raise your hand. Go ahead and raise your hand if you want to share one peer review. As I said, even if you're not able to share your screen, I'll be delighted to do the screen sharing for you. I'll go over to PeerGrid and then open up the work that you want to share on. So over to you. Especially if you've already completed 3 peer reviews, and I know many of you in the room have already completed 3 peer reviews, so please just go ahead and raise your hand. Or I might just invite someone to unmute. Let me see, who am I going to call upon? And I see we have 2 people whose audios are not on. I don't know, there is Nasir and there is Maya. So if anyone in the room, can you please send a message in the chat for Maya and Nasir to turn on their audios? Let me just, for Maya and Nasir, okay, to turn on their audios, let me just send them a quick message in the chat. And please, I'm looking on you to raise your hand. Okay, so I hope they'll get the message and be able to turn on their audio. So back to, Melissa, I don't know if you're able to unmute yourself. You're able to speak.
Hello, Charlotte.
Hi, Melissa.
Hello,
how are you?
Hello, Scholar. Good. How are you doing?
I'm good. And I'm sure you're finished peer review.
Yeah, I did all, yeah.
Yeah, so are you going to share with us one of the works that you reviewed? Do you want me to share the screen for you?
Yeah, it's okay.
All right,
yeah.
So just, okay, give me a moment while I go on PeerGrid to open up for you, and you'll tell me which of the submissions you want to review.
I think there is somebody who just I think in Nigeria there is someone who just from Nigeria or Pakistan, one of the 2.
Okay, so let me see. Okay, so this one is Nigeria. That's submission 3.
May I see my comment first?
Okay, yeah. So can you just briefly tell us what the scholar did, and then your comments? Okay, like I see.
Actually, I have reviewed 3 action plans, and I found most of them are well organized and well identified, where discuss the situation that able them to identify the potential challenge in their context. But there is something actually, like as a reviewer, there are something that I put as a comment. For example, this author has not identified a challenge as per the stated goal in the activities. Identifying the challenge may be gap, unsustainable funding and lack of government ownership. There is no challenge identified in this action plan. So, but based on the situation, the gap is unsustainable funding and lack of government ownership is maybe expected as stated as a gap. So I saw the detail of this action plan. He tried to identify, he tried to just analyze the situation and put down the main problems and develop related action plans. That's very important. He already mentioned a lot of he already mentioned a lot of problems, but try to identify also the very important gaps that will be addressed. So I give him excellent. I learned a lot from this action plan, because the way he identifies the situation, the way he discusses the situation, the way he identifies the activities that is related to the situation is very important. There is actually identified gap in his situation, and develop activities that may address the gaps that already identified. The objectives that he stated is really match with the activities that's already stated. So this was the good action plan that I reviewed, and I learned a lot. But there are 2 action plans that I reviewed from Pakistan and Nigeria, and try to develop my comments according to the gap that I identified when I reviewed the project. So this is a good project that I reviewed.
Melissa, please, I want to ask you, can you just, I hope you are able to see the screen, just summarize 1 or 2 of the actions that, let me see the comment you left on the person's goal. Let's first of all just look at the goal. He said, my goal is to engineer processes to enhance sustainable financing and government ownership of VPD surveillance. All right, surveillance. And you said there is a well-identified goal which is in line with the situation. And you gave the colleague a 4. Now, in terms of the action, okay, so I see in terms of the actions, can you just, okay, action 1 is to convene technical working group meeting to promote financing of VPD surveillance. Okay, that is in line. It's strengthening the functioning of state technical working group on health financing to mobilize funding for VPD surveillance, and then improved financing for health with improved funding and infrastructure for VPD surveillance. Do you think how, you know, when you look at these actions, and maybe when you look at these actions, I say, you said convincing actions that are likely to achieve the goal only require minor improvements. And your comment is maybe good to see other activities also to better improve ownership of the county. So But a question I'd like to ask you, do you think that the comment that you have left, because when I see the actions are a little bit generic.
Yeah, the reason that I try to put this comment is that the action plan, the author put it that there is a gap between, on sustainable financing and ownership of the country on VPD surveillances. So if there is ownership gap or there is ownership problem in a country, it should be better to state that help to take the ownership further than the currently available problems. So more of the activities that's put it here are look to address the sustainable financing, whatever the finance, but it's also very important to take the ownership that the country will take over gradually. That's very important for my understanding.
Okay, and I want to ask the other peers in the room, do you have any comments? How can the Melese, are there any comments you'd like to give to this peer review and also to this action plan? Because I just think, okay, like that there could be something more concrete in terms of actions that can be carried out. Okay, Hanan, I see your hand is raised. Over to you.
Thank you very much, Charlotte, and thank you, Melisi, for sharing your review with us. Like regarding the point that I see now on the screen, maybe just instead of saying that maybe good, it's good to see other activities also to better improve ownership of the county. Maybe you can suggest to him such activities that can enhance the ownership, because as such it's very broad, and maybe it will be very vague for him to understand which activities can in fact improve the ownership. So if you can list a few and help him with that, I think it would be good.
Yeah, thank you so much, Hanan. Yes, Hanan, please go ahead.
If you can go up or down so I can see the next, the remaining review.
Okay. I think the last part of the review, it's the credibility and feasibility.
Yes, here, and this is not just for Melisi, this is a question for the scholar team. Like when we assess the credibility, how should we do that?
Okay, that's a good question, Hanan. So, yeah, Melissa, you want? Yes, Melissa.
Yeah, thank you, Hanan, for your comments, for your reflection. Yeah, actually, when I'm just reviewing documents, I'm just giving the chance to think over again and over again is very important for the authors, because there are a lot of solutions to be included. For example, in the above comment, maybe good to include to improve ownership. So there's a lot of ways that the country can take the ownership of the VPD surveillance. So showing that there is no activity that is stated to address the ownership is for me very important, and giving the chance to identify the best activity is also maybe good to give the chance for the authors, because he knows well the situation, he knows well what exactly looks like in the country related to VPD surveillance. And when it comes to the credibility, for me, the credibility is the relationship of the action plan, the strengths of the action plan, or the strengths of the activities that address his main objective and address the main challenge that identified. So if there is a chance to identify by addressing this activity, if there is the possibility to address or close the gap that identified based on the stated activities, that is the credibility for me. To say credible, the chance or the possibility of addressing the gap by using listed activities or the main challenge that is stated should be addressed by the way or the methodology or the activities that will be stated in the accessibility, in the specific activities. So for me, as per the stated activities, he tried to achieve his best if the implementation activities done as it is stated. Yeah, that was actually my thinking.
Okay, thank you so much, Melesi. And first and foremost, I'd like to talk about for highlighting the ownership part and suggest to you that what you're saying is very important, but unfortunately, it does not appear on the feedback you gave to the author here. So, you know, the author, okay, you said improve ownership, but maybe to explain more, because you have given more explanations to us in the peer support session. If the peer is not here, the peer may not understand what you mean. And like Hanan said, to give some concrete example, like based on your context, what on your experience, what can you give as concrete examples that of those activities that were omitted by the author in their action plan? So it is very important. And then now talking about credibility and feasibility, you have explained so well, and it's here. You say that is when you look at the author's action plan, you know, do you think, are you convinced that that's an action plan that is can be implemented based on the context that has been described, based on their challenge? So here, remember, we noticed that the author omitted from explaining or describing their VPD surveillance challenge. So that is already a gap. That is already a gap. And so whatever they may be explaining, it was left now on you, what Melese, the reviewer, to deduce what their challenge is. So you did a deduction, and that already is a gap in the work that is being done. So that is just maybe one or two comments that I had concerning this particular peer review. But as it was really to also help to respond to Hanan's question in terms of what is meant by credibility and feasibility. In terms of the actions, do you find that the actions can are they feasible enough? You know, are they specific enough? Are they smart enough? Can they be implemented within a given time frame? Or if there is a way for them to be improved, what improvements can the author make? So that is what the rubric, the guidance given by the rubric as far as credibility and feasibility is concerned.
Yeah. Thank you, Charlotte. Actually, there's a gap. Actually, as I identified in the review, there is a gap. He's not stated the major challenge, but in his major goal, he showed that there is a challenge that funding and country ownership. That's clear.
Yeah. Okay.
Yeah.
Yes. So yeah. Okay. Thank you so much. And I see there is Ahmed Alda. Your mic is unmuted. Thank you so much, Melese. Thank you once again. Ahmed Alda, your mic is unmuted. Okay, I see you've muted yourself. So let me go back to sharing the PowerPoint that is for the participants' presentation. And are we going to have another volunteer who would like to share their peer review submission, answering the questions that are on the chat? Okay, Dr. Mohamed Bonos, I see your mic is unmuted.
Yeah, just say one of the work I did is somebody from Ghana. Can you share it for me?
All right, so let me go over to PeerGrade and pull it up. So just give me a couple of seconds. do that. Peer Grade is opening up. And Dr. Mohammed, there seems to be a background noise on your device. I don't know if it's your headset. Anyway, I hope, but when you're speaking, we can at least hear you clearly.
Okay.
All right, you said you wanted to look at a submission from Ghana. So we are going to see if it's the first, the second. This is Bangladesh. So let's look at the second one. The right one. Okay, this is the work from Ghana.
Yes.
So over to you. And please do start by introducing yourself.
Okay. Fellow scholars, good morning, good afternoon, good evening, and thank you for having me once more. I remain Bonus Mohammed, a surveillance officer with WHO from Nigeria. So this work from Ghana is one of the 3 articles or write-ups I peer-reviewed. This was very personal to me because I'm very familiar with, well, let me say I'm familiar with the program in Ghana because I've gone there on a number of support missions. So most of the things the guy was explaining was very familiar to me. So I saw that he had a very detailed background of the context. But then of all the details in the context, when he came to put the surveillance challenge, I saw that the challenge was limited to transportation of samples. So can you show me my comments, please? I don't know. So for me, of all that he explained in the context, I think sustainable financing was a very big challenge. At the root was the root cause of virtually everything. Am I together with the colleagues?
Yes, we are getting you. Please go ahead.
Okay, thank you very much. So, given the detailed context he gave, he put his challenge as transportation of samples to the lab. I felt that was very narrow, given the what was highlighted in the context. Because if we look at all the context, either from workforce or from the lab, or from other aspects, everything had to do with gaps in funding. For instance, in the context related to workforce, he had few health staff that are working as surveillance officer for collecting samples. I guess he had limited resources to recruit more people, especially to hard to reach areas. Now, the same thing with laboratory. There were issues of reagents, purchase of reagents, and stuff like that. I think the best aspect of the program in Ghana is the information system. I think I love the information system, the way it was described and the way it is actually running. So, can I see my comments now, please?
Okay, your comment is on the right-hand side for the context.
Okay. So I said to him, your context is detailed and highlights the weaknesses in the system. The root cause of causes for most of which is gaps in funding. Review the context, note all the gaps in your region, and reprioritize your most critical challenge. I'm very pleased to note that you have very good electronic reporting and information platforms. I bet that you desperately require funding for all the gaps you highlighted in your context. So that's what I said there, ma.
Okay, thank you. I've gone down to the goal.
Okay, so where's the goal? Okay. Let me
just go down to your comment.
The goal. Okay, yes.
Okay.
Okay, for the goal, I said a relevant actionable goal is identified requiring minor improvement. And I said, consider reframing the goal as sustainable financing of VDP surveillance for the timely detection of all suspected VDP's cases through expansion of the reporting network, collection and timely referral of specimens, timely testing of all etc. Once more, I love, the plan is to optimize the region lab capacity to test for more pathogens, etc. Once more, I love the details and it's very close to me since I have been supervising surveillance in your country for some time now. Congratulations.
So now in terms of, can you briefly just summarize the concrete actions?
Okay, let's go to the concrete action. Okay, in the concrete action, I said convincing actions that are likely to achieve the goal only require minor improvement. I said consider to include use of the required funding for procurement of reagents for the reference laboratory for the testing of pathogens. Consider optimizing the capacities of your regional lab by upgrading the testing for most pathogens. In this way, you will not have to transport your samples all the way to the National Reference Laboratory. Also, think of expansion of the reporting network, especially at the hard-to-reach areas. You may have to recruit and train more of other healthcare workers for case detection and samples collection and transport. Yes, ma'am.
Final feedback on feasibility and
Okay. Elements are feasible and feasible but require minor improvements. Majorly, most of the elements in the proposed actions are credible and doable. Please reflect on the above suggestions regarding doing more of the testing in the districts /health facilities. That is for rapid testing and the regional lab, cultures and confirmatory tests. On the whole, this is a very excellent plan of action to improve VDP surveillance in your region based on the context provided. Congratulations and good luck.
Okay, so thank you very much, Dr. Mohammed Bonos, for presenting such a great peer review. And I see Hanan Khalil, that says the chat, that is a very delightful feedback. So there are, okay, Melissa, I thought I saw your hand raised, but now there is the hand of Eric Maita that is raised. Eric, okay, let's start with you, Melissa, because you're already unmuted, and then we'll get back to you, Eric. So over to you, Melissa, and then Eric.
Thank you. Thank you, Dr. Mohammed, for your constructive review. And I have some just clarifications. I think the author stated there is a problem in testing and transportation, but I don't think he stated that funding as the challenge, and also his objective is not focused on the fundings at the same time. I saw in your comments, just you recommend that there is a chart, there is a roadmap, and you just helping him to revise and try to identify the root causes of as funding problems. And so how you just based on the stated objective, yeah, the activities are in line, but you just helping him to go address the root causes like funding and like. How you just relate, please? Thank you.
Okay, thank you, Melese. Okay, we'll listen to, before turning to Dr. Mohammed, I'd like us to listen to Eric. So Eric, I'm sure Dr. Mohammed heard your intervention, Melese, so we'll turn towards Eric. Eric, over to you.
Yes, thank you very much. Thank you very much, Dr. Mohammed, for that presentation. I have a contrary opinion. Probably the moderators or the facilitators need to give some guidance, because to me, I think most challenges revolve around sustainable financing, but we have specific challenges that need to be addressed. For example, I have not read this action plan through, but from the concept that I've just read, it appears that the most challenge is integration of annual budgeting. But to me, I feel that the issue of finance sustainability is not a big problem. The problem is actual issues of getting samples to the referral lab. And therefore, addressing those challenges, definitely some aspect of financial management, financial sustainability will arise. But the actual actionable, measurable challenge that needs to be addressed is the issue of ensuring that samples reach the referral lab in time. So that is my honest opinion, unless probably we get some guidance from the moderators. Otherwise, thank you very much.
Okay, thank you very much, Eric Maita. And I'm happy that we have SME Anna Minta from WHO who is here with us. I know, Anna, you joined while the presentation was already ongoing. But if I could just maybe briefly share with you this action plan that was reviewed by Dr. Mohammed Bonos. It's from Ghana, a regional disease surveillance officer, who said that he wants to address the challenge associated with the late submission of specimens regarding vaccine-preventable diseases to the laboratory in the eastern region of Ghana. And as challenge, he said, my region is challenged with delays associated with timely transportation of specimens for suspected VPDs to the designated laboratories for investigation, which has an effect on the outcome of laboratory results. So Dr. Mohammed Bonos, who was the reviewer of this work, said, looking at the challenge is credible, but when he goes through the context and the gaps that are identified, he feels that there are many challenges that are there, but that the priority challenge is an issue of sustainable financing. And so he has given feedback around that line. So before we listen to what Mohammed Bonos is going to take from all of the comments shared concerning his feedback, I would like to turn towards Anna to hear your thoughts and comments, or if you have any questions for Dr. Mohammed to better understand the action plan.
Yes, thank you, Charlotte, and thank you to Dr. Mohammed for sharing your work, your feedback on the action plan. I guess my first question is, without knowing the context, I mean, you were able to read through all the context, so you've identified the sustainable financing. I don't know what the underlying challenge is, but I'm sure it's there in the context. So But I will say that I agree that oftentimes the challenges are interrelated. So maybe the problem with the laboratory is that they don't have the financing to get the specimens where they need to go. So then the challenge overlaps between laboratory and sustainable financing, and that's totally fine for the objectives to be overlapping. So I would say that is fine. And I like the suggestions that you've offered about expanding the reporting network, training, and transportation purchasing. So I think it's in general, I guess I would give general feedback since I don't have all the specifics, but it is helpful when you're reading the context to do as Dr. Mohammed has done and provide concrete examples of what you think the author can use to improve their action plan. Instead of saying in general, you know, it's pretty good, but could be more broad or specific or something. So I like how you've given, it looks like in all your section, you've given very specific examples of what you think they should add. So that's very well done. Thank you.
Thank you, Anna. Mohammed, I don't know if you have any form of more, because you are the one who read the action plan. You actually tried, and you even said you have been to Ghana, so you understand the context a little bit more. So maybe you are best placed to respond to the concern raised by Melissa.
Right, thank you, Charlotte, for the opportunity, and thank you, Anna, for the favorable review, and colleagues, thank you for seeking to understand this mode of feedback. Yes, you see, he said that what we are supposed to do is the most important challenge. And of all the context, detailed context, he said his most important challenge is taking samples to the lab. Now, look at the issues involved. At the detection level and sample collection level, he has only few hands that can even detect the cases, and I think detect the case and then collect samples. He doesn't have hands that will go to hard to reach areas. Again, he couldn't do that because he doesn't have money. So I bet the more he gets money, he gets funds and gets more hands, trains more people, gets more hands to hard to reach areas and other areas. I think again, that will be easing off the issue of the sample collection and transport. Now, coming to this issue of sample transport, he is in the eastern region. So his samples will have to come to Nguchi Center in Accra. Now, even in Accra, in the Nguchi Center, he has there are shortages of reagents. Sometimes the results get delayed for months, weeks and months. So here we are saying that if his region, the regional lab can have an expanded mandate, he can have money to buy reagents, train more lab staff so that he can do testing at the regional level. He doesn't need to bring his samples all the way to Accra. Again, also this can be better also. So I think to me, all these things, the issue of training, the issue of reagents, the issue of recruiting people, WHO and AFED, they are already helping in capacity building. So they don't have much problem with that. That's what he put in the context, which I'm very aware of. But the issue of funding for recruitment of staff and reagents, and then movement of the samples. So moving samples from the eastern region or to the facilities to the eastern regional headquarters instead of to the country capital will be cheaper for him. So this is the context in which I made this review. Thank you very much. Over and out. I hope this explains.
Yeah, thank you, Dr. Mohammed Bonos. And one thing we also see from the action plan is actually the use of data points to, you know, more elaborate and explain the context. And we cannot overemphasize what Anna and India and the other subject matter experts have been saying throughout the course, that data is what you need maybe to convince potential donors, funders, and even the government on the importance of addressing the challenge that you're facing. So once again, thank you. So Eric, I don't know if your hand is still to make a comment or it's residual. It's the same hand that was raised before.
No, sorry, it's the
Okay,
earlier hand.
okay.
Sorry.
Okay,
Yes.
it's okay. So I'd like to ask Hanan. Let me see. There's another. Okay. Yeah. So Hanan, will you? Should I put up a peer review that you worked on?
Yes, Charlotte, but I'm not able to share my screen because I'm logging in from a different computer. So I don't know the username
okay.
and the password. Thank
It's
you.
okay. I'll share the screen for you.
Thank you very much.
Okay. So you may just want to remind us who you are, where you're connecting from while I put up the action plan you want to comment on peer grid.
Like the software? Or
no, I'm just saying that, please, can you just introduce yourself and you're going to tell me which particular action plan you would like to comment on.
Well, they were all of them very interesting to review. The one, let's start with Uganda.
Okay.
Yes.
Okay, so can you just briefly describe, the action plan, focusing really on the, or summarize the action plan, focusing on the actions that the peer says he's going to carry out, and then also would like to hear the feedback, the comments that you gave the peer.
Yes, so the project was about building capacity of district and health facility staff in vaccine-preventable diseases surveillance in Uganda, Gulu Akuli sub-region, and I apologize if I pronounce this incorrectly, in Uganda. So the main challenge was limited surveillance capacity of district and health facility staff to detect and report VPD surveillance in a timely manner. They described the essential pillars of surveillance and the challenges that they are facing in, but in a very clear and concise and actionable manner. But when they came to the action itself, they need to put a little bit of more work on that action. For example, here, the context should describe the current situation regarding each of the pillars. The solution of what should be done should be mentioned in the action plan rather than in the context. So in the context, they, for example, if you go to the information, they mentioned that, I think it was either in the information or in the applied research, one of them. Yes, here they said that the surveillance data should be linked to health and immunization program decision-making. Well, that's the goal. It should be linked, definitely. But here we have to identify what are the gaps that are currently present in the system. So we will work on that step by step and trying to solve them. So similar thing for the applied research and the sustainable financing. So I don't know if it's a problem with the language and the grammar, or it is he mean what he wrote in here, that it should be done this way. So the action, what I know, it should be about the context should be about the current problems, and then the action should be how are we planning to solve those problems. So here, if you can go down to the, yes, a bit down, to the goal to develop a workforce appropriately trained in surveillance core competencies, including data analysis and interpretation for vaccine-preventable disease surveillance integration approach. This will lead to early detection and reporting of the vaccine-preventable disease and attain surveillance indicators in an effective and efficient manner. So it is a good description of the actionable goal, but when we come to the details, to the actions, I think they need to put more efforts into describing these actions. For example, here, training of the district and health facility staff. This is a short and medium term, but you need to identify the action. Training on what? Is it on a guideline for the vaccine-preventable disease surveillance? Is it on the laboratory diagnosis? Is it on both? You can, maybe you can describe these in details to give a more comprehensive view of this. And again, here the people, regional hospital staff, district and health facility staff, I think you can divide these into multiple maybe workshops or multiple sessions of training to specify your target audience. Here, the outcome, for example, instead of saying well-trained and equipped health staff and VPD surveillance, I think we need more specific indicators of what do you mean by well-trained and equipped health staff and vaccine-preventable surveillance. And you can classify those, again, into surveillance in terms of reporting and documentation, and you can specify 1 or 2 indicators about that. And then for example, the lab, maybe adequacy of the samples, maybe the percentage of agreement with the external quality programs. This will give more objective rather than subjective outcome for your action 1. And again, this should be according to the pre-identified gaps, which were not described very well in the context. Clearly, let us just say. And the second action is vital to enhancing the VPD surveillance activities, which is the harmonize the hub transport system for specimens, but it was not mentioned in the context, like nothing in the context described that this was a problem that Uganda was suffering from. So it is very essential. If you want to keep it in here, then just go back to the context and state that as a problem. The capacity of transportation or the quality of the sample is a process. It can be with the person who collected the sample. It could be with the person who was responsible for preserving the sample before transportation and for the transportation itself. So again, if it is a problem in Uganda, you have to state that clearly into the context. And again, you can keep that in here and then describe what will your action be to improve the sample transportation. And for the third one, which is the training of lab, EP surveillance and data staff and data analysis and management, this is also a very essential component of surveillance, but the outcome could be, instead of well-trained and equipped staff, it could be the types of the reports that your staff will produce. For example, daily reports or weekly reports or situation reports, or it could be analysis of the data, yearly reports comparing to the other, that kind of stuff. So, and thank you again for sharing and for working on the action plan. It is a good start, but it requires improvement, more actionable. This is pretty much my review regarding this. Thank you. Over to you, Charlotte.
Thank you so much, Hanan, for this review. And I see Abebe Sosa, your hand is raised. I don't know if you have a comment on this. Go ahead and unmute yourself, and we have just about 6 minutes before the end of the session. Abebe, I'm asking you to unmute, or maybe your hand was, okay, accidentally. Over to you, Abebe. Abebe Sosa, are you able to hear me? Okay, if not, I would like to turn directly towards Anna. Since we are almost out of time, if you have any comments, please share your comments on Hanan's peer review in the chat. While I turn towards Anna Minter for her own thoughts and comments on this review.
Yes, thank you, Hanan, so much for your review and for sharing with the group. There are a couple of things I wanted to highlight. One is for the context. I agree with you that the author can include more information about what's happening right now in their current VPD systems that would provide the background that the reader needs to understand their action plan. So that's good feedback for them to make sure they're describing what's happening now. And then also for the action plan, you had mentioned for, I think it was the first action that was to do a training. I agree it's helpful to include some more specifics about what would be included in the training. And just a reminder for everyone that the hope for your action plan, it is an exercise for this course, but it's also something that you should be able to use and actually implement in your country. So whatever you're putting in here would need to be specific enough, for example, for you to share, with maybe if you're at the district level with the national level, for example, that I want to have this training, the training would be on these specific topics. We're going to use materials from a certain place that are already available, or we need to develop new materials. Have as much information as possible so that when you present this, it's more likely to be agreeable to whoever you're presenting to. So I agree that it's good to have some more details if you can in your action plan. Thank you.
Okay, thank you so much, Anna, for that feedback. And thanks again, Hanan, for taking our time to share this peer review with peers. So we are 5 minutes to the end of the session. And earlier on, I had put up the list of scholars who had not yet started peer review in peer grade 21 scholars. This is just a gentle reminder that remember this is that the deadline is today. So in under 12 hours, the deadline is going to be up. There will be no opportunity for extension. So if by that time you have not yet submitted 3 feedbacks on 3 peer reviews on peer grade, you would have missed one of the certification requirements and you won't have any extension. So please let us take our time, 2 to 3 hours to do the peer review, and then not just because it's a certification requirement, but most especially because your peers depend on your feedback. They depend on you to move forward. We have still received 3 peer reviews presentations, peer review presentations today. We listened to Melese, we listened to Dr. Mohamed Bonos, we listened to Hanan, and all of them were able to give constructive feedback to peers that will enable them improve upon their VPD surveillance action plan. So imagine if Hanan, if Melese or Dr. Mohamed Bonos did not take this engagement towards you, what will you do? How will you know what to do to improve upon your action plan? And if they have taken the time to do this, and if at the end of the day, they are not able to receive constructive feedback for them to also improve upon their own action plans, it will not be very good considering their time investment. So we know that when we are engaged on submitting our VPD surveillance action plan, we also engage on carrying out peer review. So please let us do our best to ensure that we complete this before the deadline. And tomorrow, remember, tomorrow we are going to be having our last mandatory session. for this course. So it's this is a program. So please prepare to come tomorrow to present your IA20, your VPD surveillance action plan. Why? Because you would have by tomorrow, by midnight today, and so as early as tomorrow morning, you should be able to see some of the feedback given to your action plan by peers. But you have also reviewed 3 action plans, and you should already have an idea on the changes that you need to make on your VPD surveillance action plan. So we'll be turning towards you. Most of tomorrow's session will really be dedicated to you presenting your action plans and receiving feedback from subject matter experts. And I just want to refer you to some comments on the chat. There was a comment in the chat from Eric Maitada say, for responsible person, do we indicate WHO, UNICEF, USAID if they have not been contacted? That was a question, and Anna has responded, say, yes, you can indicate the responsible person who have not been contacted yet. However, a potential risk to successful implementation is that the person indicated may find someone else responsible. So I'm reading out the comments for those who will be watching the recording later on, that they should have an idea of what was responded as a question to this. All right, so once again, thank you very much for your participation at today's peer support session. It's the last of a series of 4, and it's been a real pleasure for me to be your facilitator during these sessions. And I look forward to seeing you tomorrow. Tomorrow we are going back to 9 a.m. Remember, the session is starting at 9 a.m. Geneva time, not 11 a.m. But we'll be opening the room 30 minutes early. So at 8:30 a.m. Geneva time, the room is going to be open. You can join early for some social time, and also for you to check that your connectivity is okay and that your devices are working well in terms of audio, video, and every other thing. So looking forward to seeing you tomorrow. And thanks once again, Anna, for being here, for being our guide on the site throughout all of these sessions. Bye for now, and wish you a great day. For those who are still working on peer review, I wish you all the success. I am going to stop recording the session now. And Brenda, if you just hold on, we'll check together if you have successfully submitted your peer reviews.